Yay caravan, dil dil Pakistan, John John Pakistan, dil dil Pakistan. Everybody.
Hi, welcome to Meducation TV. This is your host Arish Jamil. Today's episode is going to be an exclusive interview with Todd Shea, who is the CEO and founder of CDRS, Comprehensive Disaster Response Services. In October of 2005, Pakistan experienced a devastating earthquake in the region of Azad Kashmir. About 80 to 87,000 people were killed and about 69 to 75,000 people were injured. Todd Shea, who already had experience with logistics and relief work in disaster areas such as those in 9/11, the Sri Lanka tsunami earthquake in 2004, and also Hurricane Katrina, decided to come to Pakistan to help with the relief efforts. He started working to deploy a group of doctors to the affected areas in Pakistan. After seeing that there would still be great need after the emergency was over, Todd decided to stay in Pakistan, and it was then when he founded CDRS, which is a non-profit society for social welfare work and disaster relief. CDRS has responded to multiple disasters in Pakistan, providing much-needed logistics and medical support to communities in need. CDRS now has more than 100 employees and more than 100 volunteers volunteering in different places around Pakistan. It was a pleasure and honor to talking to Todd Shea, and I hope you guys enjoy this interview. Hi, welcome to Meducation TV. This is Arish Jamil, your host. Today we have an exclusive interview with Todd Shea. He is the CEO and founder of CDRS. So how are you doing today, Todd?
Good. Thank you for having me, sir.
I thank you for doing this interview with us.
Great to be here.
So, first of all, before we begin anything, I just want to thank you for your work. And it's really in light of all the events that have been happening recently, especially in Paris, Lebanon, and it's really your work and individuals like you really restore our faith in humanity, I think. And it's really inspiring to see all the work that you do. So thank you for that.
You're welcome. It's an honor for me to serve Pakistan and humanity. There's a lot of good human beings there. Unfortunately, in the media, you don't hear enough about the good people and the good things. And, it's like 2% of the truth, 100% of the time is told in the media, and it's all negative. And it's a very dangerous and sad thing because it causes the reality to be perceived in a very different way than it actually is. And if perception becomes the reality and it's all negative, then that affects real people into the future, and it makes for a much more dangerous situation. And I think it's a very sad reality that we're living with these days, where the media doesn't take responsibility to be proportional in their reporting. And I think that causes a lot of hatred and misunderstanding out there.
Okay, so let's talk a little bit about CDRS. So how'd you decide to go? What is CDRS? What is its mission? And how'd you really decide to go from America back to Pakistan and start CDRS over there?
Well, CDRS is Comprehensive Disaster Response Services. And we have a mission to do compassionate and competent, comprehensive disaster relief work. And even that means long-term as well, because comprehensive disaster response is beyond just the emergency phase. There's an emergency phase, then there is a rehabilitation phase and a reconstruction phase. So there's different phases of disaster relief, and we have worked in all phases in many different places, also besides Pakistan. We've worked in Haiti and Japan and the Philippines, Sri Lanka as well on emergency projects. We have made Pakistan our home because there's unfortunately been a lot of need there. But when I was in 2005, early 2005, I was in Sri Lanka after the tsunami. Then in the summer of summer of 2005, went to Hurricane Katrina. And I literally had come back from Hurricane Katrina the same day of the earthquake. I didn't know the earthquake had happened. I came back to Maryland from Hurricane Katrina. I'd been there for over a month, rescuing animals, delivering supplies, working with the U.S. Army to rescue people, and all sorts of activities that we were doing down there. Came back to Maryland, and literally had walked in the door to see my son, sat down to a pizza, turned on the television, hadn't been in the door in 5 minutes, for 5 minutes. Earthquake in Pakistan. It was all over the news. So I looked at my son, I said, I'm going to Pakistan. Before I knew how I was going to get there or who I'd go with or exactly what I'd be doing, I knew that people were going to need help with logistics, especially in the mountains and places where it's very difficult for logistics to take place. So I called the Pakistan embassy after getting their number off the internet and told them I'd be willing to go, that I'd just come back from a couple disasters and had a lot of experience in logistics. So they gave me the number of a doctor that was putting together a team of Pakistani American doctors mostly that were going to be going from the States in just a few days from that time. And so I joined them immediately. I called them up, and they didn't have a logistics person, so I joined them. Now, what we do in those kinds of situations where there's a lot of volunteer doctors coming is if they don't have time to be doctors in the disaster zone, if they have to worry about their flights and their arrangements and their helicopters and their food and their water and their sanitation, their bathrooms, their electricity, their generators and generator fuel, their security, their tents, their blankets, liaisoning with other organizations that are partnering in the area. They need people to help organize these things. Otherwise, they'll never have time to be doctors, or they'll exhaust themselves and they'll be worn out within just a few days. So we do those things so that the people who are really trained to save lives, can take care of that business. So that's what we do. After 10 years in Pakistan, we have a lot of employees who have experience in the medical part, doctors, medical technicians, midwives, nurses. And then we have the logistics team who deploys volunteers and deploys to very difficult remote areas. And that involves a lot of times getting supplies together in trucks and managing communications with whether it's the Pakistan Army or other partners or volunteers. So we have a lot of experience now doing that because unfortunately there's been so much need in Pakistan. There's been 5 major floods, 3 major earthquakes, and 2 refugees crises in the last 10 years. And that's just the big disasters. There's been so many other things, as you know. So it's been a place where there's a lot for us to do as a disaster relief organization. But the reason I'm really there and have stayed there is because after being there for a couple of weeks when the earthquake happened, there was a lot of people there that asked me to stay. The doctors that I was working with said we were going to be sending more doctors, and they had to go back because they have jobs. And it was a bigger disaster than just a couple of weeks mission. So they asked me to stay, and they said I was doing a great job, and they wanted me to stay. So I said I'd love to stay. So I decided I'll stay at least a couple more months. And during that time, I really fell in love with the people, the children, the culture, the Ghana, and it's a Zabardast country, and it's a mystical, magical country, and there's so many good people there, and I felt that it was a great place for me to serve humanity. So I decided to start my own organization. I registered under the Societies Act of Pakistan. They allowed me as a foreigner to register the organization in the country, which was extraordinary. But we have a board of Pakistanis, and all my employees are Pakistanis. And all of our supporters are Pakistani Americans or Pakistani British, about 95% of the support we've received. So it's a Pakistani organization, and we have treated 850,000 patients plus and supported the needs of 2 million Pakistanis in their most difficult time of need in the most remote and difficult areas. And so we have worked in all the provinces of Pakistan. We've worked in Balochistan and Sindh and in Khyber Pakhtunkhwa, Punjab, and in AJK in the northern areas in various deployments. And we've also worked in Haiti and Japan and in Philippines in the last 10 years in earthquakes and tsunamis and typhoons and things like that.
Yeah, that's very impressive. So what kind of current projects are you doing in terms of healthcare specifically and education?
Well, we'd love to open up more mother-child health centers, but right now we have the funds to run one. Mm-hmm. We run that in northern Swat. It's about an hour north of Mingora. and on the way up to Kalam. And it's a quite populated area and very mountainous. And we have a healthcare center with laboratory, X-ray, ultrasound, medicines, oxygen nebulizer, and all those things that a good health care center needs, an operation theater. We have specialists that come visit from time to time during the year to do camps, medical camps and things for prosthetics and orthopedics and ophthalmology, things like that. And we also take care of special patients who, if we see somebody who is badly injured or needs physical therapy or has a disease and needs some kind of expensive surgery, these people there can't afford these kinds of things. So we're there to help them with our Special Patients Project. And then, of course, our disaster response team, just in the last year, has been in the Punjab floods. We spent 10 months in Banu during the North Waziristan operation, where all the IDPs were coming to the Banu area. We worked with Imran Khan Foundation on that mission, doing all of their medical work for them, while they did distribution of goods and resources and tents and that kind of work, water, sanitation. So we did all the treatment of patients, and we took several mobile medical teams to go out into the district and take the services to people where they were living. Because of the culture, it was very conservative, and so a lot of times we'd have to take services to people that weren't really comfortable to come to a medical facility. And the medical facilities were also very overwhelmed with patients. So we adopted a couple and made them effective. Even not just doctors and medicines, but also fixing their plumbing and their electricity and their generators, and making sure everything worked. Installing the equipment that had not been installed. These are the kinds of works that we did with a partnership of Imran Khan Foundation. So we've done a lot of great work in the field of disaster response. Just in the last year, besides those missions, also the Karachi heat emergency. So we are able to go anywhere in Pakistan within 24 hours of an emergency. And we can work in the most difficult, dangerous, remote areas, neglected areas. And not only can we go there, but we can stay for years. We stayed in AJK after the earthquake for 6 years. We're on our 6th year since the floods of 2010 in Swat. So we know how to go to a place and provide long-term services. Plus, we have 2 new programs that we've started that are more on the empowerment side. Women's empowerment, where we're helping ladies in SWAT and AJK that make beautiful shawls and embroidery and scarves and handmade goods in Thar Desert, and try to get those things to markets in the US and UK, where people can pay top dollar for them, good quality stuff that is also helping poor people have a job and generating funds so we can keep the medical services going. So we want to grow that so that we can open up more centers and give more people jobs and help more ladies empower themselves and their families through getting a good income and being taken good care of and being given a lot of respect. And then we have a youth empowerment project which aims on a non-political platform to have young people be able to serve their community. We support them with equipment and with some guidance, but they semi-autonomously decide what they want to do. Maybe they want to clean up trash. Maybe they want to plant trees and flowers and clean up their area and make it look pretty. Maybe they want to give computer lessons to children. Maybe they want to help feed or take care of stray kutas and billies. Whatever it is that they want to do, we help them do that. And when the heat emergency happened in Karachi, they were able to immediately deploy with food, water, ice, fruit, juice, and about $5,000 worth of medicines that we provided because the hospital, Abbasi Shahid Hospital, was running out of medicines and had a lot of patients. So they were able to do a great job and really serve their country. So it really motivated them a lot that we had them working on a lot of community projects. And then when a disaster happened, that group was able to come together and really serve their community when the emergencies happen. So we want to do that all over Pakistan. So we've got a chapter in Islamabad. We're getting ready to start one in Lahore. So it's new, but we have some success this year to build on that. And we also might do some recycling business where we can make some funds from scrap metal and different things and have it be a recycling program too that earns a little bit of money for them to keep doing more programs. So that's our work that we're doing. Disaster response, standing healthcare facilities in remote and neglected areas, a youth program to empower the youth and give them a platform non-politically to serve their country with local community service projects, and then the Women's Empowerment Project so that they can use the things that they, take the things that they make with their hands, the beautiful arts and crafts and scarves and things that they make, embroidery, and make money for their families and also for CDRS to keep the healthcare going in their areas.
And so the last question is going to be, if for people who are interested in supporting CDRS, is there anything or interested in getting involved, volunteering for CDRS? What could you say to them? What's available? What are the options that are available to them?
Sure. Well, we love to have partners and we love to have volunteers. So organizations that want to work in a certain area or want to work with us on a certain project, feel free to contact me. Anybody who wants to volunteer, whether it's from home helping promote our work to their friends, whether it's setting up a fundraising event at their home, or whether it's coming to the field and if they have some kind of expertise, whether it's medical or helping us in whatever way they have expertise in, they can come and work with us at our office in Islamabad or at our field work in the mountains or at our Mother Child Health Center in SWAT. They can also support us by from their community helping to start chapters. We're actually have started a chapter here in Atlanta. We've started a chapter in Washington, D.C. We've started a chapter in Charlotte, North Carolina, in Dallas, and in Chicago. So we're starting more chapters of people that want to get more directly involved in a great project. And so people that just want to donate once or just want to come volunteer for a week, or people that want to get involved with the organization locally and help us grow our fundraising chapters and our volunteer support network, it's all open. So they can contact me by emailing me on Facebook. TODDSHEA, Todd Shea is my profile, my name. And then, of course, Comprehensive Disaster Response Services, CDRS, has its own Facebook page. And you can reach me on email, Todd Shea at cdrspakistan.org, or go to the website, www.cdrspakistan.org, and you can get in touch with me.
All right. Thanks for taking out the time to talk to us. And
thank you, brother.
Good luck with everything.
Thank you.
Thanks.